Dr. Blanc, I wanted to go back to the MORPHO study you mentioned, and one topic discussed on this late abstracts, the late news, was the difference between the regions. Efficacy was mainly shown for North America and much less for Europe or Asia. Is this something which is commonly seen, or how do you read this? Because this seemed very outstanding and kind of worrying if a clinical study shows regionally so different results.
So this is something to point out. Yes, I don't have any clear explanation about this. Of course, we tend to take a look at the overall results, whatever the country where the patient has been enrolled. But the dose, of course, of gilteritinib was exactly the same. The monitoring was also exactly the same. So I don't have any specific explanation. It's very unusual. It's very unusual. We sometimes in clinical trials assessing safety and tolerability of targeted agents, the metabolism between different ethnicity can be different. For example, between Asia and Western countries, the metabolism can be different, and sometimes some side effects of some drugs can be more important in some Asian population versus non-Asian population. It's something we can see sometimes. So it might be something to consider, even if to my knowledge, the number of side effects, the hematologic toxicity was basically quite similar between those different countries. If we could have seen increase in the discontinuation because of hematologic side effects in some countries versus others, it might be one explanation for those different results, but apparently it's not the case. So it's a bit astonishing, a bit surprising. Yes, I don't have any explanation to that, but it's very unusual. I confirm.
Thank you. Thank you.
It might maybe also, maybe to finish with this important point on the type of donor used, because if we consider a mismatched unrelated donor with different mismatch, we know that those patients tend to do a bit more poorly than patients with match-related donors. But in the same way, as far as I know, there is no clear difference between the different countries based on the type of donor considered. Before randomization, patient needed to obtain a correct number of platelets and neutrophils before being randomized. And the latest point to be randomized was day 90. If the patient could not demonstrate any recovery in platelet count and neutrophil count, it could not be randomized. So it's apparently not another. It cannot be an explanation at this point.